So for me, we've worked a number of years now as part of this collaboration with both the Atrial Fibrillation and the Arrhythmia Alliance, and it's been really fruitful in helping support the developments of community pharmacists, but also improve their demonstration of the valuable role that they can play in public health awareness, such as the pulse awareness campaigns. So we've done a lot of work around utilising the resources of the AFA, translating them to different countries, but importantly demonstrating that we can help raise the awareness of what atrial fibrillation and the significant consequences of having AF-related strokes, but more importantly have a relationship from the community pharmacist and helping identify potentially high-risk individuals. So that's a really good question. I think if we look at some of the evidence base, there's a lot of work of demonstrating the value that community pharmacists can bring in detecting high-risk conditions such as atrial fibrillation. And that data is available for not just for atrial fibrillation, but also for hypertension and for diabetes. I think whenever we do these events as part of World Heart Rhythm Week or Global AF Week, we unfortunately in the UK only have a handful of practices who get involved. Now, part of that is because even though there's lots of evidence that demonstrates the benefit, what we don't find is that how that translates to commissioned services. So we've been doing a lot of work of pulling some of that data together to demonstrate, rather than just a small practice and their value of their individual data, but pulling the data to demonstrate a number of community pharmacists pulling together gives a much more powerful message to say that it's actually replicable and we can adopt this and apply this at greater scale nationally. So hopefully from pulling the data we can show what the benefits will be for UK practice, and hopefully with the collaboration of the Atrial Fibrillation Association and the Arrhythmia Alliance we can get to somewhere moving forward and commission these services for the benefit of those high risk individuals in potentially walking around with atrial fibrillation but not being aware of it.